Good morning, how are you?
Good morning, Dr. Barr, I'm great.
Good to see you. So tell me a little bit, what do you think is bothering you at this point?
I am really feeling like my face is starting to sag.
Okay.
I'd like to start addressing that and maybe some of the fine lines.
Well, you're in the right place, but let's do this. Let me have you show me exactly, if you can, where are the areas that bother you?
So here, I've got some jowls, where you see where it's sagging here, here, and down here.
So here's what I'm going to do. Our mini facelift is to get the upper part of your neck, to get the jowl and the jawline, and up into the cheek area. How does that look to you?
That's going to look great.
The person in their late 30s and early 40s is what the mini awake lift has been designed for, basically to get the jowl and jawline area, maybe a little bit under the chin, but it can go up from there. We've had a patient even at 90-some years of age who's never done anything before that did it and was very happy about it afterwards. And we do that by making a hidden incision that's going to come down here, right along the edge, and back up.
Okay. Okay.
The nice thing about this procedure, the mini facelift, is that you have complete control. You're here in the office, it's under local, you're talking to us, you're comfortable. Local anesthesia is basically just what it sounds like. It's using a needle like being at the dentist, where we're injecting with a fluid that numbs the area. The person can talk, is awake, can not feel that area at all, but it's totally asleep. The surgery itself is about an hour and a half per side. You're going to have very minimal bruising and swelling because you followed all the instructions just right. The first night you'll have some discomfort. We give you instructions on using ice compresses, Tylenol, even a pain pill if you need it. You'll be ready to be out and about the next day. If you did surgery on Thursday, by Monday you're ready to go back to work.
I never really thought that I would be someone that would be into, having plastic surgery. Once I turned 40, I just started noticing that there were, some signs of aging in my jawline and, around my nose and mouth. I didn't want to necessarily look different. I just wanted to look refreshed. I wanted to look awake and alive. The local anesthesia was the best part of it because I don't like being knocked out, but I was so relaxed and there was not uncomfortable, no pain. My recovery was fantastic. It was so easy and painless. I was able to take a shower. When I got home, I was able to shower. The hot and cold compresses helped with the swelling, and I was able to just relax. I went back to work after 2 days. I hadn't told anyone that I was having surgery, so when I came back, everyone was saying that I just looked refreshed and I must have had such a great vacation.
I am 33. I work in Palm Beach Gardens. I'm a hairstylist. I see myself in the mirror every day with my clients in front of me, so I'm constantly critiquing myself.
I know I'm young, but as we age, our lips begin to lose a little bit of fullness. So I wanted to not only prevent that, but add a little more fullness to my lips. Because whenever I'd smile, I'd notice in pictures that my upper lip would hide. So I wanted them to even out a little bit and just have a sexier look.
I like to keep my face looking as close to my natural self as possible, but just without the fine lines and wrinkles. So I just tell Dr. Barr whatever it takes to keep me looking natural.
Coming to Dr. Barr, he has such a gentle touch. I started doing fillers about 3 years ago, and it's something that's preventative.
Fillers can be put in the nasolabial fold to soften smile lines. They can put in the marionette lines for the aging face.
I start to develop fine lines over each eyebrow, right above each eyebrow, about here and here. And then also along the sides, I get some little crow's feet from smiling. And occasionally Dr. Barr will inject me here from just little scrunching of my nose. It can tend to get a little bit of fine lines in that area.
Fillers such as Voluma, Restylane, and Juvederm can help contour the face to give you a natural, fresh, rejuvenated look without having surgery.
So it helps me not only enhance my beauty, but it allows for preventative measures.
Just looking your best possible way that you can without changing too much of your natural look.
I just had my 80th birthday. I wanted to give myself a gift, and the best gift that I could do was to have just a little work done and just to refresh. And I knew that with Dr. Barr, he would know just what to do, and I would feel good and look good and feel a little bit younger.
Patient experience is so important in a plastic surgery facility. Not only is it important for the doctor to be able to listen, understand, hear, and produce, but it's really important for the patient that they feel taken care of from beginning to end.
He's always very honest with me, telling me what I need and how he can just give me a little touch to correct what's going on.
Basically, when we're talking with patients, it really is addressing their needs. We're looking for them, and we also have to see expectations.
I think in plastic surgery, it's so important to be able to hear your patients, and it's not a one-size-fits-all.
It really depends on when and how that patient is being affected. So the person in their late 30s and early 40s is what the mini awake lift has been designed for, basically to get the jowl and jawline area, maybe a little bit under the chin. But it can go up from there. We've had a patient even at 90-some years of age who's never done anything before that did it and was very happy about it afterwards.
He always makes me feel comfortable. His nurse, the people that work in his office are always there with a smile. It's really not like going into an office, a doctor's office.
You call our office, you're instantly feeling relaxed, comfortable. The voice on the other end, our front office, is unbelievable. They've been with Dr. Barr for many, many years. Our whole staff has been together anywhere from 10 to 32 years. That's a lot to say about a doctor and a staff that sticks together.
We're blessed, and really the reality of it is it's a very humbling experience to take somebody's face or different parts of the body. They have complete trust in me. I have total respect and honor for them as a person and who they are. And my job is to do the best that I can to get them what they want.
When my face is in Dr. Barr's hands, I feel very confident. I feel very calm.
When it comes to under-eye circles, sometimes you need a quicker fix. Here to explain how to eliminate them in a day is plastic surgeon Dr. Fredric Barr. Welcome to the show.
Thank you so much.
All right, so we've seen the non-invasive. You actually use filler in your practice. Quite a bit, I understand. Who's a good candidate? Who in the audience here, myself included, who might be considering this or should be considering this?
Well, anybody who really has those hollows that are under the eye that creates a kind of shadowing effect. So people come to me, patients say, listen, I feel really tired.
Is that a patient of yours?
That's a patient of ours, yeah. That's her.
So she says she feels tired or she feels okay? Or
she feels good, but she's looking in the mirror, she sees that she's tired, and people are telling her she's tired, and she's thinking that she's aging, and her insides aren't matching the outsides.
So what do you do? Explain how it works.
So here's what we do. Basically, we go ahead and bring her in. We will go ahead and put some numbing cream on first, then we use some ice, and then taking the needle very slowly and carefully, we'll go ahead and inject into those.
She's not grimacing.
No, she's great, and relatively painless procedure.
I notice you're talking to her the entire time. Talk therapy.
Talking therapy is great.
Just soothing her.
It's about relaxing and getting the anxiety down, all that stuff. It really works for everything. I'm a real proponent of using as little anesthesia as possible. If I can do it under local, I do that. I do a lot of that in my office as well.
And how long does it last?
The lasting for this is probably between 12 and 18 months.
Oh.
Yeah. Under the eyes, it seems to last even a little bit longer for that particular product.
All right, so you have all the options you want, everybody. So pick the one that you enjoy the most. Dr. Barr, thank you very, very much.
Thank you.
We'll be right back.
Imagine you're getting a facelift while you're wide awake the entire time, and you're getting encouraged to snack during the procedure.
Our cameras were rolling as the procedure was happening inside a local doctor's office. Aaron Guy explains how it works.
They actually promote this procedure, saying you can eat a sandwich while getting a facelift, or in this case, read a magazine. So we wanted to know if it was really that easy, if it was really that comfortable, and did people really get the results?
make me look better, not different.
That's always the goal with plastic surgery, but not always the results. Often you go under the knife and are put to sleep and then wake up looking like a different person.
We make a hidden incision that starts here, comes down like so, and back up. Sometimes we'll also make another incision right under your chin.
And I don't want to look different. I'm just hoping for a refreshed look, preserve what I have as I continue to age.
Robin Berman wouldn't share her exact age, but she's in her 50s. She said it was time to do something more than her daily skin routine.
My neck a little bit, jawline a little bit.
And that's why Dr. Fred Barr recommended a wake lift.
Basically a procedure that we're able to do comfortably, safely in the office, minimal anxiety, high level of safety, still with some really great results.
A wake lift because you're awake during the process. This is best if you don't want the anesthetic, you're younger and need a lift but don't need a total facelift, and if you want to be up and back to normal in less than a day.
Nice deep breath in and out behind your ear.
And as you can see, they numb her up and she's awake the entire time.
It's like being at the dentist. We inject around the ear, we do our work. We do one side at a time, stop, take a little break, have something to eat, relax, do the other side, and they're done.
She didn't want a snack, but instead, she looked at a magazine.
To be having a surgery and reading a magazine and actually comprehending what I'm reading.
Dr. Barr says his clients have been pleased. Check out some of these before and afters. The average patient doesn't swell much, doesn't bruise, and is back to normal the next day.
Wow. What do you think? I'm absolutely amazed.
Halfway through, Robin gets to see the results, and she likes what she sees.
I can see the definite difference in the line. It's huge, huge difference.
So the big question, who is the best candidate? Well, they tell me someone who is between 30 and 55, someone who wants to focus really on the jowl and the upper part of the neck, or maybe you've had a facelift and you need a refresher, or you simply just don't want to have a full-blown procedure done and you don't want to go under the knife. Another big question, how much? Dr. Barr says it really depends on each patient, but he says it's roughly about $7,500. In the studio, Aaron Guy, WPBF 25 News.